it is interesting as well that you're working with the NHS, considering that current NHS advice for healthy eating states that every meal should be built around starchy carbohydrates.
Yes.
35% on the Eat Well plate, which is the Public Health England's recommendation for everybody to eat. What does the PHC and you personally think about that kind of recommendation?
So yeah, I mean, when we first started, the first thing we actually did before the Ambassadors Programme was to do a critique of health eating guidelines, because that was, you know, the nub of the problem for us, and it still is, a lot of it. And so we came up with three major concerns, that being recommendation of no more than 35% total fat, and also the avoidance of saturated fat, and also the quality and quantity of carbohydrates that's actually presented on the Eat Well guide. And the main issue with recommending, and it's 50%, is that they're recommending in terms of carbohydrates.
Right, because that includes things like starchy vegetables and things
the whole thing, like starch, vegetables and fruit.
Right, okay, and fruit, of course.
And everything, so it's the whole shebang.
Yeah, because I've just done the classic thing there of assuming that vegetables and fruits are not carbohydrates, when of course they are. Yeah. But the Eat Well plate separates them out, doesn't it? It sort of does starchy carbohydrates and
fruit
and then fruit and veg, which are separate.
Yeah.
Whereas they function
as well,
similarly.
And like when you look at
that's
you've got
that's
like
weird.
The carbohydrates in dairy, and so when you tot all of that up, and in actual fact, you know, Trudy Deacon did an analysis of the example meals that they actually gave, and it turned out that examples ended up being about 60 to 70% carbohydrates in terms of calories.
Okay.
So like even on, I mean, in the kind of the actual, you know, appendixes of the Eat Well guide, it says 50% carbohydrates is the recommendation, but from their example menus it ends up being 60-70%. So they didn't even kind of, you know, cotton on to that.
Right.
But anyway, that aside, the reason that we're so concerned with that is because, you know, we've got a population that is increasing in terms of type 2 diabetes and pre-diabetes. So to put that in perspective, type 2 diabetes is 6% of the population, which is almost 4 million people. It doesn't sound a lot, 6%, but it's almost 4 million people, which is a lot. And that costs the NHS £10 billion per year. It is the most expensive chronic disease that we have to deal with, including cancer, cardiovascular disease, and obesity. It is the most expensive out of all of the insulin resistance related chronic diseases. And one of the massive issues is that we've got 35% of the country with pre-diabetes.
35%?
A third of the country have pre-diabetes. Right?
Wow.
So that's kind of, you know, type 2 diabetes waiting in the wings, just so that everybody knows. The people diagnosed with pre-diabetes tend to be put on metformin, and that's about it.
What's metformin?
So it's a blood glucose lowering drug.
Okay, sure.
And so it's like a really lo-fi kind of thing.
Stick a plaster on it.
But yeah, exactly. It really is sticking a plaster on a potential arterial wound. And yeah, just imagine in the future, if we don't deal with this now, that 35% falls in to the 6% of the type 2 diabetes. We've got 41% of the country with type 2 diabetes, and it just currently costs £10 billion per year. So we're looking in the hundreds of billions if we don't deal with it now. And the current total budget for the NHS is 180 billion right now. So we could well fall into that being the cost of type 2 diabetes in the future, unless we actually start taking steps.
Sure.
Now, the NHS are starting to try and take steps to tackle this. It's fully acknowledged that type 2 diabetes is reversible, as is pre-diabetes. And they have the National Diabetes Prevention Programme, and they have the Path to Remission for type 2 diabetes as well. But the problem is that within the specifications, they're still saying that 50% of your diet should come from carbohydrates. Now, for a population that has an increasing disorder of carbohydrate metabolism, to say that half of your diet should come from carbohydrates feels illogical.
Yeah.
It is illogical.
Yeah.
It doesn't just feel, it is illogical.
Yeah.
And so we're trying to kind of nudge the needle in terms of saying, look, this doesn't make any sense biologically. Also, the evidence doesn't play it out. Low carb, according to the randomised controlled trials that are out there, is more effective than a calorie controlled low fat diet, for instance. And that's part of why we're doing the study with University of Surrey to really prove our point on this.
Amazing. So one of the misconceptions that we've just debunked right there is that every meal should be built around starchy carbohydrates. What's the alternative then?
Yes, the alternative is non-starchy carbohydrates, which are low carb, high fibre vegetables and fruits, and meat and fish, basically. So like instead of having most of your plate being starchy carbohydrates, you just push that off into the bin and put just half a plate of veg, half a plate of meat or fish.
Sure.
And then that's basically it. Yeah, that's essentially what we recommend through TLC, because those people have a disorder of carbohydrate metabolism. You should really reduce your intake of carbohydrates so that you can better control your blood glucose, so you don't get those peaks and you don't end up with those troughs with your insulin, and so you create within your body a normalized homeostasis,
sure,
and biological response, and your body kind of fixes itself through that.
What about vegetarians and vegans?
Yes.
Because you've just said meat and fish right there.
Yeah.
And I assume that it's okay to sort of eat chickpeas and legumes and tofu and just have plant-based proteins as well.
Yeah, as well. So particularly with on a vegan diet, you just need to make sure that you're getting complete proteins, basically, and there are combinations of foods that you can do to do that.
So complete proteins, for people that don't know, are proteins that contain all the essential amino acids that we need, right? So meat and fish, and animal-based proteins, they have all the amino acids that we need, and then vegans sometimes and vegetarians sometimes miss out because they don't have animal proteins. Yes,
exactly. So particularly if you are just on a plant-based diet, you absolutely need to make sure that you're getting those complete proteins, which is it has to be like a combination of chickpeas and sunflower seeds and quinoa or something like that.
Sure.
But obviously with something like quinoa, for instance, you just need to make sure that your blood glucose response, because that has starch in it, isn't a high blood glucose response, and the best way to do that is through a CGM. And so everybody does have different responses to different foods, and that's why you can have some people that are being able to reverse their type 2 diabetes whilst including foods like quinoa and chickpeas and things like that, because they might not have tested, but they might have been lucky in that they've been able to do that. But if you really want to kind of get down into the numbers, you eat those foods and then check what your blood glucose monitor has told you what your body is doing. If it is going skyrocketing, then it's like just avoid that food 100%.
Because the other assumption is on the other side of the coin is that all carbs are bad and they affect everyone equally and everyone should just avoid them all. And that's just not true, right?
No, it's not. You do have to kind of if you do want to find out your own personalised response to those foods, absolutely get a CGM. And discover that for yourself. There's the universal rule where blood glucose will rise in response to carbohydrates, and your body will respond with insulin. But those, how high it goes and how low it goes, really is very individual. Because there are absolutely people that are on 100% plant-based diets that have put their type 2 diabetes into remission with a higher amount of carbohydrates in, and that's just an incredible demonstration about how different we are, and how adaptable the human body is.
Yeah.